Olá pessoal, estamos aqui com mais palestrante, Mr. Scott. Ele deu uma palestra sobre o mecanismo de ativação muscular, o que tem de mais recente sobre isso. Scott, nice to meet you. I'm glad to see you here and your first time in Brazil, right?
Yes, this meeting really has been a joy to be here because so many international experts and Brazilian experts, all with similar interests in electrophysical agents, and everybody has lots of knowledge that they're sharing, and it has been really a very good experience to learn new things, meet new people, and then have the opportunity to teach others. So it really has been a wonderful experience.
So let you know about your conference, and you talk about the muscular stimulation, right?
Yes. So I spoke on how electrical stimulation is used to make muscles contract. Talked about the differences between voluntary contractions and contractions by electrical stimulation. Talked about the advantages and disadvantages of using electrical stimulation.
In Brazil, sometimes I talk with physical therapists here, and the question is, what is better? For example, the athlete to help you the stimulation with the current, or just make the current do it at the stimulation?
Well, what we talked about is that electrical stimulation is good when you have difficulty activating your muscles, whether it be because of an injury or say a nervous system problem. Then electrical stimulation is very good to make the muscles contract and do the things that we want them to do. If there's normal activation, the voluntary system is working very well, we generally recommend to do regular exercise as opposed to using the electrical stimulation. But certainly it's very good when there is an injury or difficulties making muscles contract.
It's very good to use after surgery?
Yes, very good. After surgery, say for example knee surgery, your knee swells up and you have inhibition of the quadriceps muscle, and you can use the electrical stimulation to start retraining the muscles very early after surgery.
And how kind of current is better? Because you have the Russian and now you have the Aussie current. What is your experience with that current?
So I come from the United States, so we cannot use the Aussie current. I have read about it. I know Dr. Ward's work. So we have now studied the Aussie current. When we look at typical currents, what we would call the symmetrical, the biphasic currents, whether they be symmetrical or asymmetrical, and how they compare to Russian. I think that Russian tends to cause too much fatigue. Both currents do cause muscle fatigue, but I think the Russian probably causes a little too much. It's not that well scientifically studied, but they both are used a lot in the United States. I would say Russian may be used more clinically because it's very easy to use. You hit the button and hit go. But I like to have options because sometimes patients may not like the Russian, but they like the biphasic, or they don't like the biphasic, they like the Russian. And then having another option like Aussie current just means you have more options for your patient if one they don't like very much, you could try another.
How is your experience with the use of current and pain control?
So lots of different types of currents for pain control, and I've found that when using stimulation for pain control that some patients are very, very receptive and respond very, very well to stimulation, and other times they do not. So it's always a balance of incorporating the stimulation with other treatments, using the stimulation to help reduce pain, to then be able to accomplish other things, maybe provide some temporary relief so you can exercise or do other things. But I have found that sometimes it works very, very well. But sometimes people don't respond, but that's like all treatments. You have to find the best treatment for your patient.
Funny, sometimes I visit some clinics or facilities in the US, and I saw one time the patient go out to the hospital. He make knee surgery, and the physician give you the little tents to use it in the house,
right?
Himself, right? So how do you explain to this guy, how can I use this equipment?
Oh yes, patient education is very important, yes. So we would never recommend giving something to someone and just letting them go.
Yeah, because in Brazil, do not do that. You know?
Yes, we don't do that very much. The therapists in the U.S. would always try it out in their clinic, make sure that it's of benefit to the patient. If they're seeing very good benefits, then I teach you how to use it. I make sure you know how to use it. I watch you do it before I send you home with the unit.
Okay, thank you so much. Thank you to talk to us. So have a pleasure day here.
Thank you.